Welcome to the Malaysian Trauma Registry onboarding session, designed specifically for healthcare professionals committed to improving trauma care through data. This video will guide you through the essential process of entering trauma data into the MTR platform. This video will guide you through 3 key objectives. First, to help healthcare professionals understand the step-by-step process of entering trauma data into the Malaysian Trauma Registry. Second, to demonstrate the essential features of the MTR platform, making data entry smoother and more efficient. And third, to highlight the importance of accurate data in driving better trauma care, smarter system design, and ultimately, saving lives. Accurate data entry is crucial for understanding trauma epidemiology in Malaysia, and ultimately, improving patient outcomes. This is the MTR dashboard to your center's notification overview. Here, you can quickly see the status of your cases using visual charts. See this chart? It shows your progress. The blue bars are for cases you haven't finished yet. The gray bars are for cases you've already completed and submitted by clicking the dispatch button. This chart helps you see how many records you've entered each month. On the right, this donut chart shows you exactly what's pending. The pending work list chart breaks down pending cases into 3 categories: incomplete, requested edit, and requested delete. This chart provides a clear picture of the necessary actions for each case. Now take a look at the left panel. Depending on your access level, you should see at least Patients, AIS, Analytics, and Logout. If you see additional options, those are only available to admin-level users, like data managers or data analysts. Scroll down to find your work list. This is where you can see all the patients you've already entered. Press Edit to open the data entry worksheet and make any necessary changes. Press Request Delete if the patient no longer needs to be notified. To add a new patient, first, click on the Patient tab. Then, click Search and Add. Before entering new details, it's best to search for the patient using their IC number. If no results are found, you can click Add New Patient to register them. If the patient is already in the system, simply click Notification to begin. This simple step helps prevent creating duplicate records and entries in the system. When adding a new patient notification, you'll be given 2 options: Core and Core Plus Extended. If you choose Core, you will only see the required fields that must be completed before you can dispatch the case. If you have more information available, you can select Core plus Extended to view all data fields. The extended fields are optional, so you can fill them in if you have the details. Choose the option that best fits the information and time you have. The patient notification form is divided into 8 key sections, but you only need to fill out the first 7. They are Section 1, Patient Demographics. Section 2, Injury Event. Section 3, Out-of-Hospital Care. Section 4, Emergency Trauma Care. Section 5, Further Management. Section 6, Injury Pattern. Section 7, Outcome. Section 8, Submission Validation. Once you've entered all your data, you have 2 options. If you want to save your progress and return to the entry later, click the Save and Exit button. When you're ready to submit the patient notification, simply click the Dispatch button. Once you've selected your data option, go ahead and expand the section to begin entering patient information. Required fields are clearly marked with an asterisk, so be sure to complete those before dispatching. Most fields use drop-down menus, tick boxes, or radio buttons, making data entry quick and straightforward. Only a few sections require free text input, so you won't need to type much manually. This layout helps ensure consistency and minimizes data entry errors. Some fields in the form are automatically calculated to make data entry easier. For example, when you enter a valid Malaysian IC, the system will auto-calculate the patient's age. Fields such as GCS, total ISS/NISS, time to CT, time to key intervention, and ED length of stay are also auto-computed based on the time entries you provide. Just make sure your input times are correct, and the system will handle the rest. Now let's walk through some common pitfalls during data entry. A quick reminder when entering time-based data. Make sure to carefully check the following fields: date, time in 24-hour format, year. These details are easy to overlook, but they're critical for data accuracy, especially in time-sensitive cases. Always double-check before dispatching. If you select Others as an option in any drop-down or field, don't forget to fill in the Specify field that appears. Leaving it blank will trigger an incomplete status, and you won't be able to dispatch your data until it's filled in. Always double-check for any required Specify fields when using Others. In the Submission Validation section, you'll get an overview of all the data you've entered for the patient. There's no need to fill in anything here. Just review the information at a glance. If everything looks correct, click Dispatch to submit the data. If you're not ready to submit, click Save and Exit to return later and continue data entry. Important reminder: after clicking Dispatch or Save and Exit, wait at least 1 minute to allow the system time to process your data. Avoid clicking multiple times, as it may lead to duplicate submissions of the same patient. This is the end of video. Good luck and all the best.